Welcome to the Chiropractic and Legal Injury Podcast, recorded live at our events. We're here bringing you the expertise, insights, and tools you need to navigate the world of personal injury care and to uncover what you didn't know about car accidents. It's no accident you're listening today, so let's get started. Welcome to the Chiropractic and Legal Injury Podcast. We are filming live today at our event. It is the Chiropractic and Legal Injury Conference. We are so excited to be here at Venue 8600 in Scottsdale. It's a gorgeous day. We're excited you're here. We have an amazing guest today, and I cannot wait to jump in.
Thank you for having me.
Welcome. So take a moment, tell us about yourself, Stridewell, and what inspired you to establish the practice.
Absolutely. I'm originally from New York and trained in neurosurgery. Over the years in medical school, became very interested in neurosurgery as a specialty, and finally got into a residency in the same program and started building my knowledge and expertise in spine as well as brain surgery. My wife and I decided we wanted a better quality of life, moved out west to Phoenix, Arizona, never looked back. This is an amazing place to live. Over the years, I've gravitated towards spine care, and it became a passion and a calling, and so I've transitioned as a neurosurgeon into predominantly spine-dominated practice. Over time, we were well perceived, and over time, I noticed that a lot of my patients were injured in a car accident. And although the medicine is the same no matter how patient comes about, the business of medicine is different. And that almost forced us to contemplate another venue which is able to understand the needs and medical care for an injured patient. Yeah. And that's how Stridewell came about. We thought that it would be better to train the staff to know what's important to these patients and how to better approach that care. We're in our 8th year of practice, and Stridewell, thank you. Stridewell has been doing pretty well. Over time, we realized that it's not just spine that gets injured. Yeah. A lot of our patients come in with concussion symptoms or extremity injuries, such as shoulders or hips and knees. Yeah. And some others needed injections to treat their spine conditions or others injuries. And so we've expanded into a full repertoire of specialties provided by medical doctors that would serve a community such as injured patients. So at this point, we are providing concussion assessments and treatments, spine assessments and treatments, including surgeries, interventional pain management, where a fellowship-trained anesthesiologist and a physiatrist will provide injections to the spine or joints, like hips or knees. We have an orthopedic specialist who specializes in joint arthroscopy and is able to fix a shoulder or a knee injury. And we also have a neurologist and a neurosurgeon, myself, who specializes in spine surgery, and our neurologist provides concussion-related evaluations, headache treatments, and such.
Wow, it's a very multidisciplinary approach that you guys take over there. Mm-hmm. How do you find that it really impacts care, especially for personal injury patients?
The reason why we grew into this multidisciplinary approach to care is because of the needs of the patients. Yeah. They don't come with isolated injuries. A lot of our patients will come in with cervical or neck whiplash and a concussion and a torn shoulder joint. And so access to care is what drove us to expand. And because we're having such a hard time getting treatments for our patients, we decided let's provide these services under one roof so patients don't have to decide where they're going to go, how they're going to get there, and getting used to different providers, different people managing their care. Unfortunately, when you get injured, your life turns upside down. Yeah. You lose track of time, you can't work, your family becomes a burden because everything is just overwhelming. And patients need a lot of, I don't want to be paternalistic, but almost hand-holding in order to get them to the appointments, get them care, because without care, they're not going to get better, and it just protracts everything. To make matters worse, they're not working, so they're financially strained, and their car may be in a shop or not available, and they have no means of transportation. So I feel for these patients. It's quite a mess to be in that predicament. And so the least amount of work we make them do, the more, and it's a bad word from the past, compliant. Patients' compliance is very important, but now we just want to engage them as patients to get them better.
Yeah, and make it easier, because I know as a mom, I have a 5-year-old, that life in general is overwhelming, like not even including an accident or anything, and trauma, and making sure that they're taken care of, because that's a really maternal instinct, right? And putting myself last, right? But making that easier to do is definitely something that has a lasting impact for people.
It's interesting you mentioned motherhood. My concussion patients who are women with children are the most difficult to treat because they take on the world and they feel like they can persevere and move through it. And I tell them, you need to become selfish for a while. You need to allow others to help you. And unless you have dependents who cannot function without you, you need to let your family know it's you time. And it's hard to do for a woman and a mother.
I feel it's hard to do in general, right? Because that just feels very unnatural. And even adding the stress and the adrenaline and the worry, and heaven forbid my child was in that car accident, right? It's definitely something that I can relate with wholeheartedly. That's awesome. So where about are your clinics?
We try to provide access to care in a way that is least stressful to the patients. So our main clinic is in Central Phoenix off of the 7th Street and the I-10. That seems to be easier for the patients to get to. And we recently expanded into East Valley, so patients don't have to travel for an hour or two to get to us. With Phoenix traffic, it used to be a very easy to get around city, and it's no more. People spend at least 40 minutes, even if you're going 20 miles. So we're expanding into West Valley, Sun City, Northern Scottsdale. We want to make sure that we have a presence at least once a week or maybe half a day in multiple locations rather than having the patient come to us. It's easier on the practice to be in one location, but we've realized that it's almost impossible for patients to make that commitment.
Yeah, prioritizing the patient's needs, again, as you kind of said, allowing your company to grow around whatever it is that they really need is kind of just an amazing thing. And it does make it easier for the patient because they have so much going on.
Going to a chiropractor 3 times a week for an hour, plus the traffic of getting back and forth, that's a full-time job in itself.
Oh, absolutely. And not including figuring out your car, and then if you have kids and adding all of these other things in, and then hopefully, we talked about a statistic before, but hopefully you don't get in another accident, because there are lots of crazy drivers out there, and there's some 300 car accidents a day in Arizona.
The city's only getting bigger and busier. And people in general feel distracted on a regular basis. I see teenagers texting and driving all the time, and it breaks my heart because they're going to be in some kind of a predicament at some point in their life. You can't be distracted on a busy street anymore.
No, you can't. It's just, there's too much going on. And then you get multiple distracted drivers, and you have...
Perfect recipe for disaster.
It is. I love that you really have that integrated care, and kind of in that is that collaboration aspect, right? And one of the things that we really try to do at these conferences is talk about collaboration, because collaboration truly transforms care for the patient. How do you find that your office really collaborates both within, all of the disciplines, and also outside with law offices or any other specialty that you kind of supplement?
Well, we realize that we are just one element in their care. Without an attorney, they won't be able to receive care or manage their situation. Without a chiropractor, we won't be able to advance care. As specialists, we provide oversight and support to chiropractors, physical therapists, but we're not the heroes of the treatment. Chiropractors and physical therapists are. They are there every day. They're seeing these patients 3 times a week for an hour a day, and they're the ones who are moving these patients to recovery. I see them once a month, but they've been to a chiropractor 28 times in that period of time. So we rely on these partners to do the good work that they're doing in order to help the patients. I feel that it's a two-way street because we are providing an oversight that is so detrimental to their care. For example, about 40% of my patients on the MRI have findings that are a concern to a chiropractor. For example, spinal cord compression or nerve impingement, something on the or a fracture, for example, something on the MRI or the X-ray that the chiropractor may not always be aware of. And so we would make it a point to call those physicians and providers to make sure that they're aware, and that way nothing bad happens to the patient. With the best intentions, if a spinal cord injury is missed and not treated expeditiously, that could result in devastating outcomes. So we're partners, and we can't do the job without them, and I hope that they see us as partners contributing to the safety of the patient.
Absolutely. I think that it's really important for them to see it, and also, again, as we're here, talking about collaboration, and we have the multidisciplinary panel to be able to kind of walk through cases and everything like that, and open those lines of communication so that the patient is taken care of on all aspects, no matter how many pieces are part of that puzzle, right? That it seamlessly fits together and provides the best care for the patient.
Absolutely.
Yeah, I love that so much. So if you had one piece of advice that you wish every person who was in a car accident knew, what would that be?
Well, first, I see so many patients who have no hope. They feel their life is upside down, especially concussion patients or patients who are not getting better with chiropractic. I think that the most important thing to do is not to get angry at the situation. We can't control the destiny or the outcome or that event that happened and let them to that in that situation. So first, just realize that it is what it is and move past that. Save that energy on learning about their condition, becoming a engaged patients. The patients who are working with me are so much better off and get better so much faster. You can think of me as a coach, but an athlete is the one who's getting medals. The coaches don't win medals, and patients need to be those athletes where they need to take ownership of their health, they need to research, they need to understand. And an engaged, educated patient is easier to treat because they are on your side. You simply need to show them where to go to get better and how to get there. I don't have to do the work for them, and we have a collaborative effort in that regard where we're trying to educate the patient, get them engaged, and be on our side.
Yeah. Education is a huge component for all aspects, right?
Absolutely.
And another great thing about these conferences is that, right? We are able to exchange the communication and the knowledge of the other perspective, the other side, and only build better cases and be able to provide better care.
Yep.
It's such an amazing experience to do that.
I would agree. It's very enjoyable.
Do you have a specific story or a memorable case that just, stays with you?
Every time a patient comes in with severe sciatica and nothing has worked, they've gone through chiropractic, they've gone through physical therapy, they've gotten injections, and they still miserable, and life is just
hard
at a point where they can't function. The quality of life is really poor. When these patients go through surgery, it is amazing to see the results. It's almost always resolves, and these patients wake up pain-free. And the elated feeling that they have and their perception of life changes, that's just such a gratifying experience. Perhaps the most impactful cases are my concussion patients. Concussion is, patients don't realize that the brain is broken. They know the back hurts, the back must be injured. They can understand a shoulder injury, but brain is the kind of thing that they can just keep going. They keep working, they keep managing the family, they keep managing the finances, but the brain is actually broken and they are struggling and they don't understand why. And the family members get angry, the children get angry, and no one can explain what's going on. So the level of frustration that happens in these patients is just overwhelming. And then they sit down with me and I tell them, what you're experiencing is a concussion. And it's almost like a pound of weight fell off of their shoulders. And they're opening their eyes like, wow, can you tell my family that I'm not crazy? This is all real? And the amount of times I see that and experience that, it's just amazing to see how burdensome it is to the patient. The good thing is that probably 99% of our patients with concussions with proper treatment get better. Although 40% without treatment don't get better, and that's the latest statistics. Can you imagine being injured and never get better from a concussion if you didn't get proper treatment? That's how devastating this could be.
Oh my God.
But the treatment is long and onerous, and patients need to do a lot of hard work. But there's light at the end of the tunnel. And when I tell them that, they feel like
Relieved.
there's hope.
Yeah.
I can do this.
Yeah. I feel like also they feel that validation, right? Like I knew there was something wrong, but I couldn't put my finger on it. I couldn't explain it. Or even maybe I saw a doctor and he said that I was fine, or you know what I mean? That validation that yes, there is something wrong with you. And the other part about the story you were telling is that a lot of times we'll get into the pain as our normal and not even realize that there is something else out there that's not pain, right? That we could live a life without this. We're just so used to it.
I had a patient, middle-aged patient with teenage kids come in with his wife, and she was ready to divorce him. Wow. His personality changed. He sustained a concussion, and she thought that he was just being a different person. We just grew apart. And when I told them that, her jaw dropped. It saved their marriage, which shocked me that it had gotten to that point.
Yeah. Sometimes when you can't explain something, or I was talking to a friend just about having a word to describe what it is that you're feeling, or the thing you're going through, or the condition, or anything is so important, both for just acceptance and healing and knowing that you can now move forward with it. Right. It's so important to be able to label it and understand and have that perspective as well. Like, oh, this is not just nothing. This is something, and now I understand.
Absolutely.
That's awesome. So what's something that maybe your patients don't know about you? What do you do on the weekend? Or
Well, I'm a father of 3 girls, and my oldest just had a child, so I'm a proud grandparent.
Grandparents.
Yes. My wife and I are spending all of our free time enjoying our 9-month-old granddaughter. It's a very different experience. I've been a parent for 30 years, and when you're a parent and you're growing up with your kids, you're learning about childhood through their experiences, and you're still working and doing everything else. It's one thing. But being a grandparent, you're seeing things from a very different perspective.
Yeah.
It becomes more of a, what would my grandchild remember when I'm not around? It's a legacy kind of a feeling.
Yeah.
And you're trying to be on your best behavior, but also I'm expanding my view of how I want to be remembered, which you don't usually do. You don't self-reflect to that degree unless you have grandchildren. Somehow that just clicks and makes you a different person.
That's such a beautiful thing. I also feel like it's one of those things where being in the trenches or not, right? Because as a mom, I'm like, I don't have time to reflect about this. No. I need to get him to lunch. I need to go to school, do soccer practice. Like he gets sick, all of these things. And then I feel as a grandparent, you have a little bit of space, right? And you're not kind of in those trenches anymore to really reflect. And there's this great, it's a meme. It was like, my mom as a mom, you take what you get and don't throw a fit. My mom as a grandma, absolutely, I'll cut the middle cake out of the section and just give it to you, which is 100% true, Mom. Just absolutely a different thing. But grandparents are absolutely supposed to spoil their grandkids, and congratulations. That's such a beautiful, beautiful thing.
Thank you. I appreciate it.
That's awesome. Well, thank you so much for coming to this conference and for speaking with us and telling us all these things, and we're so excited. Do you want to tell people where they can follow up with you or online, your website?
Absolutely. Stridewell.com is our website. A lot of information describing our services, and people are on there. And obviously, you can always reach out to us directly, info@stridewell.com.
Awesome. Well, thank you so much for being on. Thank you, everybody, for listening.
Thank you for having me.
From all of us at the Lazzara Law Firm and the Chiropractic and Legal Injury Conference, thank you for listening. We hope you never need us, but if you or someone you love does, know they'll have a team dedicated to helping them rebuild, recover, and reconnect with what matters most, their loved ones and the life they deserve. This is the Chiropractic and Legal Injury Podcast, where knowledge is power and collaboration transforms care. If today's episode opened your eyes, share this episode with your network and help spread the word about the realities of personal injury care. Follow us on social media to keep learning and connecting with this incredible community.